For those of you that have joined, I'm Jennifer Ride with QSource. We're going to be talking today about HQuick. It's another CMS acronym. So it's the next generation of the Hospital Quality Improvement Program. Many of you may have already participated in previous versions of this program. And we're going to be talking to you today about how you can continue that good work or maybe start working within this program if you haven't done so already. Looks like it's 11 o'clock, so we'll go ahead and get started. I mentioned HQuick is funded by CMS. It's designed to help rural hospitals, critical access hospitals, and hospitals that really see underserved or vulnerable populations. And so what we're here today to talk about is HQuIN, which it's a program of HQI, or Health Quality Innovators. HQI rather is it's a nonprofit. They've been funded by CMS since 1984. They're a QUIN QIO for Virginia, South Carolina, Missouri, and Kansas. And we're the QUIN QIO for Indiana, and, also a nonprofit. So, we're very similar organizations that have been involved, for quite some time with, with these quality improvement initiatives. The evolution of the hospital quality improvement started with the Hospital Engagement Network in 2011. So there were 17 different HINs that began working with hospitals. They worked on to reduce all-cause harm events and also reduction of 30-day readmissions. And then in about 2016, we saw this Hospital Improvement Innovation Network get HINs, which was also to reduce all-cause harm and to also reduce the 30-day admission rate. So now we're seeing this new next generation called the Hospital Quality Improvement Contract. This again is focused on the small rural critical access hospitals, and there's an alignment of national priorities across a lot of different initiatives. So this is going to be about reducing disparities, behavioral health outcomes, opioid misuse, patient safety, patient engagement, and quality of care transition. So many of you may have already participated in these over the years, but even if you haven't participated, it doesn't preclude you from getting started now. And I just wanted to take a minute to explain about QSource. We're really assisting HQI with recruiting hospitals. We have worked with hospitals for years, and we get feedback to say, hey, how do I continue this journey of quality improvement? And so we're just really wanting to connect you with HQI. They have a very similar background to QSource. They're also, like us, very centered around improving the healthcare experience and, across the nation. And as we've been involved in the HIN or the HIN contract, as it may be, depending on your pronunciation, we really want to be able to help you and make that handshake with you with HQI so you can continue that support. They will be actually the support contractors in this initiative. Again, we're just helping them with the recruitment. So HQuIN is part of the HQuick network. So again, it's really designed to improve those outcomes, help reduce the provider burden, to facilitate some sharing of best practices, learning from other hospitals that may be similar to your situation. So this is backed by 4 years. So this is a 4-year initiative. It is at no cost to providers or hospitals. And it's really, about helping navigate these value-based programs, hospital readmission reduction, and improving star ratings. So the national priorities, and you're going to see this repeated among many of the CMS initiatives. So behavioral health and opioid misuse or, opioid reduction, patient safety, care transitions, and public health emergencies, the latter of which is probably on everyone's mind at this particular moment. A common thread across these national priorities is actually patient or person and family engagement. And so really, learning how to engage your patients, your families, and help them help you make decisions about your quality improvement initiative. We know you're really, really busy. We don't want you to have to duplicate, resources, and we want to be mindful of that, throughout these initiatives, whether it be the QIO program or HQuick. And so this is really, like I said, these programs are designed to coordinate together through these national priorities. I will just mention that in this particular slide deck, I will be sending that out to everyone that's participating on this call. I have some additional slides that I'm not going to show today because they really talk about each one of these priorities and what the focus is under each one, but I didn't include that today in interest of time, but I will be sending that out for everyone to review. I really wanted to concentrate more on the COVID-19 response because I think that is first and foremost on everyone's mind at this particular moment in time. And so there is some immediate support in this program for your COVID-19 response. There's a COVID-19 hospital preparedness checklist that you can start using immediately. It's proven to help you sort of address some of the gaps that you may have in your system or just tighten up what you currently have, to help you, navigate through this current pandemic. So these are the elements of the COVID-19 plan for your review. There's 7 elements to this COVID-19 plan, just to facilitate communication, look at your consumables and DME, education and training, how are you going to deal with surge capacity, for example. Those are types of things that, you want to be planning for going forward. Excuse me. There's also, some things that you can plan in advance for, like the spread of the novel infectious diseases, keeping your staff educated, making sure that they are well prepared, well trained, and really equipped to deal with, what's going to be coming in the, upcoming weeks and months, and preparing for COVID-19. But also, HQI is going to be helping you maximize your infection prevention program. Again, we want to protect our workers. We want to reduce the transmissions. And so all of this can be done through this program to help you with those things that we know are going to be paramount. And the way that technical assistance is going to work is HQI will provide a quality improvement advisor that can coordinate with your corporation, because so many hospitals, are part of a corporation and they want to do things as a group, or you may have some group leadership, or you could be an independent hospital. But either way, they're going to work to coordinate with you, whether it be as a group or as an individual. And then they're going to be providing updates and progress regularly, to make sure that you stay on track and that you have a methodical way, to address those priorities that you've already established. And this is a collaborative approach. I mean, this is, involvement. You learn together, so you're going to be addressing what's important to you when it's important to you. Yes. Do you have a question?
I was trying to do that toll-free number up there.
I think somebody's not muted, but that's okay. If you have a question, feel free to interrupt. This is, like I said, this is your presentation. So again, this is going to be a collaborative approach to improvement. Really, HQI is there to provide a start-to-finish data analysis, look at those things that are priorities to you, provide some individualized coaching and accountability, and an evidence-based approach to, making sure that it's easier to achieve your goals. As I mentioned earlier, there is alignment with with the HQuick and QIO, for example. So you could be participating with both of these organizations, in your state. So these are just some examples of different types of strategies where HQI, for example, may help you set up a ED crisis team for your medication-assisted treatment referrals, where the QIO would be maybe working with providers to connect providers with local pain management alternatives. So there's a little bit different approach, but the goals are the same, like a reduction in adverse drug events or opioid misuse by 7%. So national priorities sort of aligned across multiple CMS initiatives. So there is your commitment is necessary. And by the way, I wanted to mention too that CMS actually provided all the HQIC entities with a recruitment list. So they've indicated which hospitals they would like to participate in this initiative. And so if you received information from us, it's because you're on that list. Commitment is not hard. It's just completion of a participation agreement or a commitment form. Providing access to data. Now, HQI is committed to getting data from NHSN. You can confer rights so that they can mine that data and then provide feedback, and also through Hospital Compare. So they're really working to reduce any burden of access to data, which I know is a big issue. And you'll need to, of course, engage in some of the QI activities, virtual learning events, and then be willing to share best practices with other participants. And so here is a picture of the HQI team, and they have, again, a very long history of working among multiple care settings, development of tools and resources, and really, providing that one-on-one assistance that's really going to be critical, in these coming months and years. And finally, this is my information. You can certainly email me, call my office or cell, and you can also email techassist@keysource.org. That actually gets information to a multitude of us if one of us isn't available. But by all means, feel free to contact us. And I'm going to stop talking. I've been talking for about 12 minutes. So if you have any questions, please feel free to unmute, and we're happy to answer questions. Karen Shiner is on the call. She's from HQI. I apologize. I should have introduced you sooner. And she's also available to answer questions for you. So I'll stop there. Are there any questions that you may have or anything you want to address? You can type it in the chat or unmute, whichever you prefer.
Jennifer, while we're waiting for some folks to think about some questions they might have, I can certainly share the most common questions that we've heard as we've had conversations with hospitals. I think the most frequent one that I've heard is that, given the pandemic, they are just overwhelmed right now. And so they may be excited or they may be very interested in participating in this initiative, but they really are just kind of in that place where they feel like they cannot sign up for one more thing, or they just don't know that they can do it right now. And so let me start off by saying, first of all, we completely understand, and so does CMS. We do have a narrow window of recruitment time to get you signed up for the initiative, but that doesn't mean that you have to start immediately. We can absolutely delay, the next steps in terms of, beginning to work on initiatives. We completely understand that that's really probably not your main focus and top of mind right now. So we get that. And, we've had folks who say, I need help with COVID right now, but I don't want to focus on anything else. And we can do that too. So the idea is really just trying to be flexible and to meet your needs right now. And for some, they do want help, and for some, they say, let's hold off, and that's completely understandable. We just would like for you to go ahead and fill out that participation agreement. That way we can get you connected into our network, and then we can work with you from there on what you want to do and how you want to do it. It really is about you choosing your priorities. We went through that priority list and those, you don't have to work on all of those. You get to choose what you want to work on and the pace that you want to work on those items. So this really is about meeting your needs. I know for many of you, you may have board directed initiatives that you need to work on, or things that you may be working on for value-based payment arrangements. And so we can absolutely help you with that and come alongside you and be your partner in those, recognizing that you have limited resources, you have limited staff, and we certainly don't want to duplicate efforts. We'll align what we're all working on together to make sure that we are making best use of your time and resources.
Thank you, Karen. That's great information. And, so, my takeaway from that is there's a sense of urgency to really go ahead and participate in the program and sign up, because there will be a recruitment period. But, starting out, and I've seen this on initiatives that we're working with CMS, is they've really shown a lot of latitude about working on things, because they don't want to overburden the healthcare system at this particular moment in time. That's good information. And one thing you and I talked about last week too is, hospitals can spend as much or as little time, as they have currently. I mean, there's the time commitment is really based on, what they can afford at this point.
Yes, absolutely. That's another question we tend to get is, what does the time commitment look like? And it really is based on what you're able to give. We have some hospitals who want to work on a couple of different initiatives, and so of course that may take some more time if they want to work on, a couple of different things. And some have said, I can only work on one thing at a time. And we've said that's perfectly fine as well. We completely understand. So, it really is, you will have a quality improvement advisor, or QIA, that would be assigned to your hospital, and that's your go-to person for really working on these initiatives. That's the person that will coordinate efforts and get you the tools and resources and get you connected to your peers. That person will probably want to do a call with you maybe once a month or every other month, kind of depending on what you're working on and how quickly you want to work on it. But again, we will be flexible to your needs and to your situation, knowing that right now things are really fluid. And frankly, knowing that, as we go forward, even once we get beyond the pandemic, you have a lot of things on your plate. And so it may be that you start out working on an initiative and you need to put it on hold because something takes greater priority, and we understand that. So we'll work with you on that as well.
Karen, can you also talk about quality metrics?
Sure. So right now, with this particular contract, CMS didn't prescribe the quality metrics. They are leaving that up to the different HQIC organizations to come up with their own. And so just like with the data collection, we are trying not to be burdensome with this. We've certainly heard feedback from those that have participated in the HIN program that between the measures and the quality, the data, that could be very overwhelming, and sometimes they didn't feel like they got a lot of value out of that. And so we're trying to be mindful of that and really choose things that will be meaningful. You don't have to report on all of the quality metrics. We're actually in the middle of deciding on what those metrics will be. If you are interested and want to know more about what we're currently working on, I'm happy to share with you our preliminary list. It may change. I want to put that out there only because we're continuing to work on that with CMS, but we're not trying to have a what I'd call a laundry list of measures, and certainly not process measures and things of that nature. This really is about only collecting the data that's going to be meaningful and that will really track progress and give us a window into, are we meeting the goals and targets that we want to meet and that you want to achieve as an organization.
Great, thank you. Are there any other questions? Like I said, you can type them into the chat or feel free to unmute and ask any questions. I'll give you, stop talking and give you a minute to think. Well, I will say again that I will send out the commitment form. Actually, in the PowerPoint that you'll get, you can click here, and it will actually also take you to the link on the web. And we just ask that you download it and send it back to techassist.org, or I'm sorry, techassist@qsource.org. And I just want to say again, thank you for your time today. Thank you for the amazing work that you're doing, caring for all of us, for your patients, and for their families. We really appreciate the hard work that you're doing. And we'll be here for a few more minutes. If anyone has any questions, we'll stay on for a couple of minutes, but that really concludes our presentation. All right. Well, thank you, Karen, for your insights and your assistance and for the information.
You're welcome. Happy to participate.
Great. Well, again, thank you all. We'll go ahead and sign off. Again, you know how to reach us, techassist@qsource.org, or feel free to email or call me. I'm happy to assist you any way that I can. All right. Bye, y'all.